At Weaving Voices for Health and Justice, we believe everyone deserves access to safe, transparent, and healthy products, especially for the most intimate parts of our bodies. That's why we talk about vaginal health. We focus on programs and policies that reduce exposure to harmful chemicals because vaginal and vulvar health are deeply connected to both reproductive health and our overall well-being. So let's break down a few things we think everyone should know. While the vagina is not often thought of as a route of chemical exposure, it absolutely is. The vagina and vulva aren't like the skin on the rest of the body. This tissue is covered with mucous membranes and has many blood vessels with direct access to the circulatory system. This means chemicals used in or around the vagina can potentially be absorbed more easily than products used elsewhere on the body. The vaginal environment is healthiest when acidic. A healthy vaginal pH is naturally acidic, usually between 3.5 and 4.5. That acidity helps protect against irritation and infection and keeps harmful bacteria from overgrowing. This brings us to the vaginal microbiome, which depends on this balance. Yes, the vagina has bacteria. In fact, it has a whole ecosystem of bacteria known as the vaginal microbiome that plays a major role in balance and reproductive health. In a healthy state, this microbiome is usually dominated by beneficial lactobacillus bacteria. These bacteria produce lactic acid, help keep pH low, form a protective barrier, and make it harder for harmful bacteria or infections to take hold. When lactobacillus levels are low, the microbiome becomes more diverse with many different types of bacteria. This imbalance is linked to higher rates of reproductive health issues, including bacterial vaginosis, infections, preterm birth, infertility and miscarriages, sexually transmitted infections like HPV and HIV, certain reproductive cancers, and pelvic inflammatory disease. The products we use matter because vaginal exposure to chemicals from menstrual and intimate care products may disrupt the delicate balance of a healthy vaginal microbiome. Some chemicals can kill bacteria, including the beneficial bacteria, and some products, like certain lubricants, can change moisture levels in the vagina, which can cause a breakdown of vaginal tissue and further throw off balance. Research also shows significant racial disparities in vaginal and reproductive health outcomes. These disparities are not the result of individual choices, but are shaped by stigma around vaginal odor and hygiene. Because of these stigmas, many people are encouraged to use menstrual and intimate care products that promise freshness or cleanliness. When we pair these social pressures with higher exposure to products with harmful ingredients, it raises important questions about how these products interact with the vaginal microbiome and how exposure drives disparities. Now that you know a little more about how the vaginal microbiome works, we encourage you to keep learning. Check out our resources to better understand how menstrual and intimate care products can influence vaginal health, become a more informed consumer, and join us in supporting policies and regulations that protect vaginal and reproductive health.